Social media's impact on news regarding COVID-19. How have their actions, or lack thereof, impacted users' perception of news regarding COVID-19? COVID-19 was declared a pandemic by the CDC in March of 2020. There has been a lot of misinformation spreading on social media sites such as Facebook, YouTube, and Twitter. The problem here is the amount of false information about COVID-19 circulating around social media sites, specifically the top three, such as Facebook, YouTube, and Twitter. Those are the ones that Americans typically rely on for their news coverage. Facebook has already begun implementing a fact checker to help decrease the spread of fake news. What other measures can Facebook, YouTube, and Twitter take to combat this issue? How have their actions, or lack thereof, already impacted users' perception of news regarding COVID-19? What is social media's impact on news regarding COVID-19? Research on this topic is necessary so we can determine the most effective way to communicate information regarding the pandemic and how to ensure users receive accurate information. Facebook has been named as the most used social media network for spreading information about the outbreak. Since the start of the pandemic, people are using social media sites to gain information about the virus. Several sites have published information about COVID-19 as well as instructions to prevent the spread of the virus. The World Health Organization declared that they are currently experiencing a social media infodemic because it has accelerated both information and misinformation. The mass media has been called on to take responsibility for publishing correct information. Some social media companies have taken efforts to remove false information from their platforms. For example, in India, the government asked top social media companies like Facebook, YouTube, and Twitter to stop publishing misinformation. Also, the Vietnamese Ministry of Health created accounts on social media networks and published correct information about COVID-19 to the public. Social media has been listed as playing three main roles in the pandemic. 1. Facts about the outbreak were published on social media. 2. Misinformation and fake news about the outbreak was published on social media. And 3. Social media created fear and panic globally. Social media advancements create opportunities to keep people safe, informed, and connected. However, the same tools also enable the current infodemic that jeopardizes measures to control the pandemic. Young people are a key group in the social media context of this pandemic because they are the most active online. More than half of Gen Z and millennial social media users report being very aware of fake news surrounding COVID-19 and can often spot it. The challenge, however, is in recruiting them to counter it rather than just letting it slide. Social media companies are a key factor in influencing the public's perception of COVID-19, and they have been a powerful tool in spreading misinformation. The method to be used in this study is a quantitative survey that will obtain data from a random selection of social media users. Users will participate in an online questionnaire aimed to determine the impact of social media on the spreading of misinformation regarding the COVID-19 outbreak. Questions will include asking users to spot examples of fake news and garner suggestions for further action from social media companies. Results from this study are likely to show an acute awareness of fake news. Social media will be highlighted as a key source in spreading misinformation on COVID-19. The initial questions prompting this study were, what other measures can Facebook, YouTube, and Twitter take to combat the spread of fake news, and how have their actions, or lack thereof, already impacted users' perception of news regarding COVID-19? What is social media's impact on news regarding COVID-19? Other measures Facebook, YouTube, and Twitter can take to combat the spread of misinformation is to stop publishing fake news content, implement fact checkers, and have authorized accounts dedicated to publishing accurate information on COVID-19. Social media heavily impacts news regarding the pandemic. The results of this study are to be expected based on former research on this topic. Based on this study, social media is likely to influence the spread of fake news on topics other than COVID-19. An unexpected result of this study is the younger generations, such as millennials and Gen Z's, impact on the spread of fake news on social media. A factor not previously taken into consideration was the age of the most active social media users. Potential limitations of this study are the news resources available in different areas of the world. Social media may be a last-minute resource for some and the primary resource for others. Location may impact the results of the study and the information users are exposed to. Social media has played a large role in the spread of fake news regarding the pandemic. Factors to take into consideration are age and location of social media users. It is important to understand this infodemic to recognize fake news and combat the spread. If social media has been this powerful at spreading misinformation during the COVID-19 outbreak, What can be expected of them in the future, and how will this impact social media users and the public? This is my final slide of my presentation. Here I've listed the sources used for my research paper. I hope you enjoyed the presentation and learned a lot about social media's role in the spread of misinformation regarding the COVID-19 pandemic.